Okay. Hi, everyone. I am Caitlin Silva, and I have a private coaching practice called Beacon Parent Coaching. And this is our first interview of the series of this week, talking to moms so they can share their stories of how COVID-19 has impacted them both personally and professionally. And today we're lucky enough to have Ashley here joining us. Thank you, Ashley, for joining us. I know it's amazing that you're able to join us because you've just worked a 12-hour shift, right?
Yeah, I mean, I've definitely, I work at Lawrence General Hospital. I'm a nursing supervisor there. And so I've kind of been seeing everything firsthand, how busy, the emergency room is, our ICU is, all the changes we've had to make for the patients that are coming in. So we've definitely been putting in like more hours, longer hours, and the hours that we are there, it's like much more intense than it has been in the past.
Yeah. So why don't you start off by just telling us a little bit about yourself, your family, your profession, your career, things like that.
Yeah. So I'm the mom of four. Jake, who is in middle school, he's 12. Emma is 9 and in the 4th grade. Kate is 7 and she is in the 2nd grade. And then I have a 6-year-old Gabby who's in kindergarten. And so we live in Salem with my boyfriend, who's a Salem police officer, and we live right around the corner from their dad, who, is lucky enough right now to be working from home. And so we all kind of, we do a good job of co-parenting, I think. And yeah, so then I started this is a second career for me, being a nurse. I was a social worker first, and then I went back to school and became a nurse when I was 29. So I've been nursing since then. I did floor nursing, I did home nursing, and then I was in the emergency room for 6 years. And then I just recently became a nursing supervisor at the hospital.
That's amazing.
Yeah, so yeah, I touched a little bit of everything.
So you're so busy between working and 4 kids, and
yeah,
you must be running.
I feel pretty tired all of the time, but I'm sure do.
It's kind of your baseline.
Yep, exactly.
Yeah. Okay, so before all of this craziness happened, before COVID-19 was here and we were remote learning from school and a lot of people working from home and social distancing, before that happened, what was a normal day like for you?
Yeah, so I mean, you would get up in the morning, get the kids ready, get them off to school. I work 3 to 11. So during the day is like when I got like most of my housework done. I got, most of the cleaning, laundry, food shopping done. Any of doctor's appointments that I had or the kids had, I was like, I'm home. I was able to do all of that. Going to the gym, which is like one of those things that I need to do for like stress release, kind of just taking that me time to like, get myself in shape and like out of stress. And then if I worked, I would go to work 3 to 11. I usually didn't get home till like 12 or 1 in the morning, and, start all over again. And then if I didn't, I'd pick the kids up from school, do homework, do sports, get dinner ready, get to bed, and that was like a typical night with when I'm not working.
Yeah. And trying to sleep in the meantime.
Yes. So sleep.
Great. And so now that this has happened and now that we're facing this pandemic with COVID-19 and all of the changes that have taken place, how has that impacted you, your life, both personally and professionally?
Well, I mean, so now that like I'm home and the kids are homeschooling, obviously my 2 little ones need a lot more help. My 2 older ones, can like kind of get their schoolwork done on their own. But my little ones definitely need help. Like they need guidance. They need somebody there to like be telling them like, we got to do this next, or helping them with it. So my day like is consisting of now homeschooling. And then I'm definitely working longer hours, more hours at the hospital just because of they need more help. So, trying to fit in time for sleep and for exercising and for any of that is pretty much like definitely 3rd and 4th on my list of things to do. So it's just definitely harder to juggle all of it.
Yeah. And how has it changed your work life and your normal? I mean, being a nurse already is amazing. And, we're also thankful for you guys, but you're miracle workers on a normal day. And then you add in the risk that you're now facing and the longer shifts and the lack of supplies from what I'm hearing that you guys have. And how is that impacting you, when you go into work? It was like, how are you feeling when you have to go into work? How do you feel when you leave work?
I mean, like, there's definitely that talk you have to have with yourself, like, before you go in, because, like, a lot of times I'm just like, I just can't do it. Like, I just don't want to do it anymore, because you're there and you're anxious the entire time. It's just like, there's just constant stress because there's not enough supplies. We're worried about running out of supplies. And then it's the patients, like, they're sicker, they're like a lot sicker. And so when we're responding to codes, and I'm responding to rapid responses of patients who are getting sicker, it's just, we know that they possibly have it. We have to, like, gown ourselves up first, and before we can even go in the room to help them. So you're worried about, am I getting it on right? Am I, or if am I far enough away from them that, like, I can just do this from the doorway and, like, run a code. So everybody's on heightened anxiety there. And, as far as being a nurse, like, I've seen some, and especially an ER nurse in Lawrence for 6 years, I've seen some pretty horrible stuff. And I probably only cried like 3 times in my entire career. And, like, the other day was one of them, because I just, like, hit about seeing all these people suffering, and they're just suffering. And
Yeah.
there's not a lot we can do for them. Like, they're just basically, going into respiratory distress, and, like, they're going down fast, and it's just really hard to watch that, and then also their family members, like, can't really be there for them. So we're the ones holding their hands, and we're the ones, like, talking to them through their, like, their last breaths. And it's just really, like, it's a heartbreaking thing to watch. And we're just doing it more and more and more, and we're going to be doing it more in the next few weeks. And I think that everybody's just kind of trying to get through it. But I think after all of this is done, for nurses and doctors and respiratory therapists and everybody who's, like, working together, like, there's going to be a lot of, like, PTSD from, like, what we're seeing and, like, what we're going through. So it's just, it's definitely more stressful. And I'm, worried to bring it home to my kids. Is the other thing, is that, like, I can't social distance. I can't stay at home. I can't stay away from this. I'm, like, in the middle of it. So for me, like, I'm putting my kids at risk, but, like, not by choice.
Yeah, that's something I was thinking about too. It's, you're putting yourself at risk, and that's scary. But then to think about bringing it home to your 4 kids, is another stressor for you. And that kind of goes into my next question: is what are some of your biggest worries, stressors, or fears right now?
Yeah, I mean, it's definitely, like, either me getting sick and not being able to take care of my kids, or not being around to take care of my kids, or it's, bringing it home to my kids and one of them getting really sick. It's, passing it along to people. Like, I really, most of us in the healthcare field, like, know that, like, we're probably going to get it. Like, it's not a matter of if, it's a matter of when. And, like, I just don't want to be one of those people who passes it on to, like, countless others. You know what I mean? Like, I don't want to be the one to be spreading this.
Yeah. And so, it sounds like that must be tremendously stressful for you. And, you talked a little bit about what you do for you, but, what are some recommendations that you can offer for other healthcare professionals or just other moms going through it, for how to manage that extra stress, and how to make sure that even though you're feeling like there's not time in the day for one more thing, making sure that self-care is somewhere in the midst. It may not be in the top 10, but making sure that it's somewhere. What can you say to those moms?
Yeah, I mean, I've been, especially with the nice weather, like, even if I just go for a walk, and, like, social distance while I'm walking, like, I always try to walk on the other side of the road if somebody's coming, put my headphones on, and just kind of, like, just take, like, 10 minutes, even if it's just, like, around the small block, just to, like, take time for yourself, or, like, take that 10-minute bath, like, just with music on, to, like, it's really so important to even just take 10 minutes a day for yourself, to kind of just regroup, and you'll be better for your kids in the end, you know, because you're kind of a
Yes.
little revitalized. So it's just, yeah, like 10 minutes is all it takes, you know?
Yeah. Yeah. No, I think that's an important part right now, is to make sure it doesn't have to be something big or grand or a long duration, but something where you just feel like you're shutting the world out for a little bit and you
Exactly.
can just pour into yourself. Because I think, every time my phone dings and it's an alert or it's an update or it's a debriefing, and I'm like, I just can't. So, like, I don't want to listen all the time. It's a little overwhelming for sure.
Hmm.
So I think some days I just take a break
Yeah.
from that stuff, and I try to do something, whether it's just locking myself in a room with a good book
Hmm.
or just going outside. And so something, so that every day I'm taking time to kind of reset. Otherwise, you're not going to have any ability to really care well for your children if you're already at a point where you're done.
Exactly.
So as a nurse and as a mom, what what would you like to say to anyone watching, in regards to COVID-19, in regards to taking this seriously, social distancing, and following the guidelines and recommendations that the government has given us?
Yeah, I think we're like past the even the point of social distancing. I think we're at the point of like you're like stay at home. If you are not
Yeah.
staying at home and only going out for like vital things, it's not helping. So like going to a friend's house and like even just sitting outside, you know, having a fire or whatever, that's just it is
Mm-hmm.
not, you know, the stay at home recommendation that they're giving right now. Like if the family member, if this person doesn't live with you, you shouldn't be with them.
Yeah.
Just kind of period for right now.
Mm-hmm.
And you know, like as a nurse, I'm just, you know, it's not just hitting older people, it's hitting younger people. Like people who aren't sick to begin with, completely healthy
Mm-hmm.
30-year-olds are intubated right now, in the ICU, you know, nurses and doctors in New York have, you know, died from this. So it's
Yeah.
just not something that like we should be fooling around with. It's not
Sure.
something to take lightly. This is not just the flu. You
Mm-hmm.
know, right now my hospital and hospitals around the country are worried about ventilators. Are we going to have enough for the
Mm-hmm.
need of the people who are going to need them? And we're already, you know, kind of planning on like one ventilator for two people, which we have never done before. That is like how serious this is and like how fast people get sick from it. So and if you are fortunate enough that like you don't have to go out and work, and you don't have to go anywhere, like just stay home, you know.
Mm-hmm.
Like I wish I could stay home with my family. I wish I could
Yeah.
just shelter in and like not have to go out, but
Right.
like we have to. And so, you know, and like that's the job I signed up for, which is fine. But to see other people not doing it kind of is hard for us as healthcare workers, and you know, especially first responders, to look at, because we're like, we don't get that choice.
Yeah.
And if you do have that choice, like please just make the right decision and stay home.
Yeah.
And, you know, help the rest of us do our job.
Right. Well, and that's something that I was thinking about, is that, you guys are going into work for sick people to take care of us, and you're risking your health and your children's health to do that. And so it must feel a little bit disrespectful if
Hmm.
you see, families outside playing together, and then, and just, not taking it seriously, because potentially by them not taking it seriously, they're putting a chance for all of them to be exposed, to then come and flood the hospitals where you're working, and
Right.
now taking up more resources, more time, and making it even harder for you guys to save the people who you can, because they're playing together. And I know, you and I both have children. It's not easy for them to not play with their friends. Every day, my 10-year-olds are asking me, I just miss my friends. Can we just go ride bikes, or can we just go for a walk, or can they come over and we'll sit across? But it's not, they're not going to be able to do that. It's too hard to
Right.
be that close. And so it's a sacrifice that that my family is making
Hmm.
to do our part in helping flatten the curve and helping, get through this as soon as possible, so that we can have fun and see each other and socialize. And, that's a big part of our life. But it's hard for me when I hear people say things like, oh, it's just the flu,
Hmm.
or, I want my kids to get it. It will build up their immune system.
Yeah.
What would you say to someone who said something like that?
like, this is not just the flu. It's so much more than that. And, we don't have a lot of, not a lot of research has been done on it because this is not
Mhm.
a man, like,
Oh, I think we lost your voice for 1 second. I think you cut out. Can you still hear me, Ashley? Can you hear me?
oh, I can hear you. Can you
Oh,
hear
okay,
me?
now you're back. Sorry,
Okay.
we lost all that great stuff.
Oh,
Do you
no.
mind repeating? So when you were getting into the fact that this is not a man-made virus, it came from an animal, I think is what you were saying.
Right. So
Oh. We lost you again. Can you see me? Trying to see if it's a different spot or if it's just the connection between us.
no, can you hear me?
Oh, now I have you. Every time you start talking, we lose your voice. Someone's trying to stop you from getting this important message out.
I know,
All right,
seriously.
let's try one more time and see.
Okay, so what I was saying is that, like, this is not a virus that our bodies are used to. So we don't have antibodies. We don't know a lot about it. We don't have any vaccines. We're using medication as trials and, like, hoping that they work. Most of the time, patients are so sick that by the time they get to us, they're being intubated, like, right as they get into the emergency room. So there's not a lot of time for us to work on things before they get really bad.
Yeah.
And they're going bad within like 12 hours, people getting symptoms too. So it's not like, they get the cough and the fever and then 12 hours later, they're literally in the ICU intubated. So it's not something that, like, you can get like a pill for and go home, and it's
Right.
when they're getting it, they're suffering. It's like,
Yeah.
it's a horrible disease or virus to, like, watch.
Yeah. And so they're not allowed to have family members with them. Is that correct?
Correct. Right. We've had some that have passed away that still their test had not come back yet for. So family members, like, literally were allowed to walk by the door with masks on to say goodbye. We're having no visitors at the hospital. So, like, even, other patients aren't allowed to have visitors in, unless they're, like, really not doing well. So, like, loved ones aren't able to see their family members in there, and so a lot of people are just unfortunately dying alone.
Right. You're struggling alone, you're sick when you're alone, and then you're potentially dying alone.
Yep.
And so there was something on Facebook that I saw that said, that if your child gets this and is sick, that parents are not allowed in there with their child. Is that accurate?
So no, we're allowing one parent
Okay.
in. They are, like, they have the mask on the entire time they're there. But they do have a parent. We allow one parent at a time.
Okay.
And so we're trying, like, usually it's two parents, but we're trying to cut down on the number of people who are there.
Yeah.
So they are allowing, at least for children, they're allowed to have a parent with them or guardian.
Okay.
But it's also, you're putting yourself at risk as well,
Right.
as a parent. But obviously you do that for your child.
Yeah. But if you can prevent it by staying home,
Exactly.
that's what we should be doing.
Yeah. Like, even, like, going to parks, like, there might not be anybody there, but it stays on surfaces for hours and hours and hours. So if somebody's there and they've been playing on the swings and your child then goes on the swings and touches it and then touches their face, they're potentially getting the disease as well. So, like, just because there's nobody there at the park doesn't mean you should probably go there.
Okay. So yeah, your recommendations are just, stay to your own family, playing outside in your yard, but not with other kids.
Right.
Not having visitors and not going to parks. That's the only way you can really ensure that you're keeping your exposure really to a low level. Except when we have been going out, my husband or I have been going out to the store one at a time, not both of us. Right. Grabbing what we need, coming in and basically, like, Lysoling and spraying everything and washing our hands and letting some stuff stay outside and sit for a little bit and just doing what we can. And I think a lot of people are afraid to go to that extreme because it looks crazy. Right. But I think it's something important. Yeah, you have to take it seriously. Yeah.
Yeah, like it's like not I know people are sometimes may think that they're like overreacting, but like they're they're shutting down the entire
Right.
country for a reason. You know what I
Right.
mean? Like they
Yeah.
wouldn't do that unless this was serious.
Right.
Um, and it is. And so
Yeah.
like taking the precautions that your family is taking is like exactly what everybody needs to do. And like
Hmm.
being the bad guy, unfortunately, is like the parent's job right now. And like
Right.
you can't say yes just to be like, you know, make your kids happy. Like you want them healthy and alive is more important.
Right. Yeah. Awesome. So my last question, because I believe wholeheartedly in trying to focus on the positive as much as you can, and focus on what's working. So I'd like to end on a conversation of hope. And so, when this is all over, when we get to the end of this and the world is safe again and we can, socialize and play and see each other, and we don't have to, be anxious all the time, basically, like when this is all over, and, what's one hope that you have from that will come from all of this, or one hope of something that might be different or changed?
I kind of, I really hope that people like learn to enjoy the little things again. You know,
Mm-hmm.
like I've enjoyed like having the kids home and being able to go for family walks and
Mm-hmm.
sit at the dinner table and have like, you know, dinner all together instead of, you know, one person at, you know, this sport and this person at
Right.
that house and
Sure.
this person playing across the street, and like, you know, just the family time together is like,
Mm-hmm.
you can't take that for granted, is the little things that you can like spend with your family and enjoy with your family and being together, and you know, not being forced to but wanting to, you know,
Sure.
and like really just enjoying your time with like everybody.
Yeah. Thank you. And I hope that everybody remembers, just what an amazing job, all of you in the healthcare world are doing right now, because, you're really putting yourselves at risk, but you're doing it to save people and help people. And, I think people always had a big respect for nurses, but I think at this point it should be even bigger. So from everybody, we just thank you so much for all that you're doing. And we'll just, pray that you stay safe and your family stay safe, and this passes over as fast as possible.
Thank you so much, and thank you for having me.
You're
It was nice
welcome. Thanks for
talking to you.
coming.
All
All
right,
right.
thanks.
Thanks.
Bye.
Bye.